看不到，奇怪。
Min, you're muted.
Can you hear me? Can you hear me now?
Yes.
Good afternoon, good evening on the East Coast, and good morning in Asia. Welcome to UCLA Asia Pacific Center's Taiwan in the World program launch event. Can you hear me? Can
I
you
cannot
hear
hear
me?
anything.
Can you hear me now?
Oh, yes, I can hear you now.
Okay, let me. Somehow I got the echo. I don't understand why. Can you hear me now?
Yes, you're good now, Min. Go ahead.
Thank you. Sorry about the technical glitch. Good afternoon, good evening on the East Coast, and good morning in Asia. Welcome to the UCLA Asia Pacific Center's Taiwan in the World program launch event and the Taiwan in the World lecture series inaugural forum. My name is Min Zhou, Professor of Sociology and Asian American Studies, the Walter and Shelley Wang Endowed Chair in U.S.-China Relations and Communications, and Director of the Asia Pacific Center at UCLA. Our center promotes greater knowledge and understanding of Asia and the Pacific region on campus and in the community through innovative research, teaching, public programs, and local and international collaborations. We encourage interdisciplinary work on cross-border and supranational issues such as economy and politics, language and culture, population and environment, and the sustainability in the ongoing processes of globalization. Our center currently has a Taiwan Studies program, the Program on Central Asia, and the Global Chinese Philanthropy Initiative. We are also trying to raise funds to establish a Hong Kong Studies program and other relevant programs. Our center has recently received a gift of $2 million from the Taiwan Ministry of Foreign Affairs to establish a Taiwan in the World program and a Taiwan Studies Endowed Fund to help permanently support Taiwan studies at UCLA. In today's launch event, I would like to first invite UCLA Vice Provost Cindy Fan. I'm getting the echo again. I would like to first invite UCLA Vice Provost Cindy Fan to offer welcome remarks. Professor Cindy Fan is UCLA's Vice Provost for International Studies and Global Engagement. She is the first woman and first Asian American to hold that position. As Senior International Officer, she manages UCLA's international partnerships and agreements, represents UCLA globally, and oversees the 27 interdisciplinary research centers and 8 degree programs within the International Institute. Professor Fang received his PhD from Ohio State University and an honorary Doctor of Laws from the University of Bristol in the UK. She has been Professor of Geography at UCLA since 1989. Professor Fan's research focuses on population, migration, regional development, gender and ethnicity in North America and post-Mao China. Professor Fan has published widely in these areas and has delivered keynotes in the US, Europe, Asia, Australia, and Africa. She was a recipient of UCLA's Distinguished Teaching Award, Distinguished Scholar Awards from the American Association of Geographers, and many prestigious fellowships and grants. Professor Fan, please go ahead.
Thank you so much, Professor Min Zhou. It is my distinct honor to welcome you on behalf of UCLA to this launch event for the new and innovative Taiwan in the World program. This program will support a new lecture series on Taiwanese society, culture, and political economy in a global context. Also Chinese language instruction at UCLA, as well as other academic activities on Taiwan. And as Professor Zhou mentioned, this program is funded with a very generous gift of US $2 million from the Taiwan Ministry of Foreign Affairs. Without the support of the Taipei Economic and Culture Office, Los Angeles, or TACO, this gift and this new program would not have been possible. So on behalf of UCLA, I would like to sincerely thank Director General Louis Wang and Director David Lin of TACO for your tremendous support and work. And it is wonderful to have Professor Frank Chen, a good friend, and Professor Jason Wong to speak at this inaugural forum. Now, Taiwan in the world is an extremely timely and forward-looking vision. And I'm grateful to the Asia Pacific Center led by Professor Min Zhou for this vision. UCLA's mission as a public research university is the creation, dissemination, preservation, and application of knowledge for the betterment of the global society. In other words, global and local engagement is in UCLA's DNA. And both the vision of Taiwan in the world and the long-standing collaboration between UCLA and TACO are testament to our commitment to global and local engagement. To me, TACO is not just an educational partner, but a friend, one that is full of great ideas, very warm, and a great pleasure to work with. And I look forward to celebrating with TACO in person when we can. The same qualities, full of great ideas, very warm, and a great pleasure to work with, also describe our fearless leader, Professor Min Zhou. So Min, thank you very much for your incredible leadership and big congratulations on this new program. In addition, I am grateful to Asia Pacific Center staff, Elizabeth Lester, Executive Director, and Aaron Miller, Assistant Director, for their tremendous effort and outstanding work. Finally, I'd like to thank the numerous faculty, including many academicians at UCLA who are originally from Taiwan, as well as many alumni, supporters, and donors who have ties to Taiwan, for helping to build a momentum toward UCLA's closer collaboration with Taiwan. And I look forward to hearing the remarks by Director General Louis Wang, as well as the dialogue between Professor Frank Chen and Professor Jason Wong. Thank you very much.
Thank you, Vice Provost Fan. Our center's Taiwan Studies program was launched in 2014 with an initial 3-year Taiwan Studies lectureship or TSL grant from the Taiwan Ministry. From the Taiwan Ministry of Education through the Taipei Economic and Cultural Office in Los Angeles. The TSL grant has since renewed twice, from 2017 to 2020, and again from 2020 to 2025. The support from the Taiwan Ministry of Education has enabled us to grow the Taiwan Studies program. Now, this program thrives with other sources of support, including the UCLA NTNU Taiwan Studies Initiative, directed by Professor Su-Mei Shi of UCLA Asian Languages and Culture, Comparative Literature and Asian American Studies, as well as endowment and scholarship funds from the Jackson Young and Family Foundation. Our Taiwan Studies program activities include lecture series, academic workshops, and conferences faculty exchange, curricular development, and undergraduate and graduate fellowship and scholarships, as well as research and travel grants for students and faculty doing research on and in Taiwan. These activities have fostered strong collaborations between UCLA and Taiwan and a growing interest in scholarship about Taiwan at UCLA. We have also provided emergency assistance for Taiwan students affected by COVID-19. Last year, our center worked closely with the Taipei Economic and Cultural Office in Los Angeles to receive a major gift from the Taiwan Ministry of Foreign Affairs to establish a Taiwan in the World program and a Taiwan Studies Endowment Fund at UCLA. The main purpose of the Taiwan in the World program is to expand the production of world-class scholarship on Taiwan in a global context and train a new generation of scholars and professionals to be well-versed with Taiwanese society, history, and culture, and to be bilingually proficient, including the ability to read and write traditional Chinese characters. The program includes several key components: a lecture series, a translation initiative led by Professor Michael Berry, Director of the UCLA Center for Chinese Studies, curricular development, and traditional Mandarin Chinese language instruction, and an interactive website. It is now my great honor to introduce Mr. Louis Wang, who is co-launching with me our Taiwan in the World program. Mr. Huang has been Director General of the Taipei Economic and Cultural Office in Los Angeles since July 2020. He received his master's degree in public administration from Idaho State University in 1991. He joined Taiwan Ministry of Foreign Affairs since 1990 as a diplomat, serving as Deputy Director General in the Department of European Affairs, Taiwan Ministry of Foreign Affairs, Deputy Secretary General of the Coordination Council for North American Affairs, Director of the Taipei Representative Office in the United Kingdom, Director General of the Taipei Economic and Cultural Office in Houston, Director of the Congressional Liaison Division of the Taipei Economic and Cultural Representative Office in the United States, and Deputy Representative of the Taipei Economic and Cultural Representative Office in the United States. Director General Huang, please go ahead.
Vice Provost Cindy Fan, Director Min Zhou, Professor Frank Zhang, Dr. Jason Wong, distinguished guests, ladies and gentlemen, good afternoon. It's my great pleasure to join Vice Provost Fan and Director Zhou to co-launch the Taiwan in the World Lecture Series event and its inaugural forum. As we know, UCLA is a research university with a worldwide reputation. Over the years, UCLA has cultivated numerous talents for Taiwan, the United States, and the rest of the world. UCLA has also received support from governments and private sectors in many countries that precede extensive cross-disciplinary research projects. My government's donation to UCLA late last year was to set up the Taiwan in the World program and its Asia Pacific Center. The Taiwan in the World Lecture Series is one of the 4 major projects in this program, which focuses on enhancing the status of Taiwan studies in the field of social sciences globally. We hope this program will become a benchmark for Taiwan-US cooperation in higher education and cultivate professional talents with global visions for Taiwan and the United States. As the topic of today's forum is Lessons from the Pandemic, Taiwan's Response to COVID-19 and the Future of Global Health Policy and Research, I would like to elaborate on Taiwan's efforts. It's why I have Taiwan's Formosan bear in the background with a surgical mask on. Okay, Taiwan is a global leader in containing COVID-19 thanks to its proactive government and the public's cooperation with the government's advisory measures. Unfortunately, now with the new clusters of variants of the virus recently recorded, Asian governments with stringent COVID-19 measures ranging from Singapore to Vietnam to Japan to Taiwan are now battling the upticks in cases. As diseases know no border, the importance and urgency of the global health and epidemic alert system stand out in the crisis. International cooperation and acting now are the right, smart, and the only choices we have to end the epidemic. As a responsible international stakeholder, Taiwan is making its best efforts to work with the World Health Organization and global health leaders to ensure that all people enjoy living and working conditions that are conducive to good health. Regrettably, the public health professionalism and sense of global responsibility Taiwan has displayed underscore the irrationality of Taiwan's exclusion from the WHO and its information channel due to political objection. We urge the WHO and related parties to recognize Taiwan's long-standing contributions to public health, disease prevention, and the human right to health in the international community, and to include Taiwan in the WHO. Taiwan will continue to work with the rest of the world to ensure that all enjoy the fundamental human right to health as stipulated in the WHO Constitution. Thank you.
Thank you very much, Director General Wang. One of the main components of our center's Taiwan Studies, Taiwan in the World program is our lecture series. The lecture series aims to disseminate knowledge about Taiwan and shed light on Taiwan's political economy, international relations, the U.S.-Taiwan-China relations, as well as Taiwan's economy and society, political system, social structure, and institutions. In today's inaugural forum, we will have Professor Frank Chang at UCLA and Professor Jason Wong at Stanford to discuss Taiwan's successful response to COVID-19 pandemic. I now introduce Professor Chang, who will then introduce and interview Dr. Wang and moderate the Q&A session. Professor Frank Chang is Distinguished Professor and the Wintech Chair in Electrical Engineering at UCLA. His main research interests are in high-speed semiconductors devices, integrated circuits for digital, analog, microwave, mmWave, terahertz systems, and RF wireless interconnects. Professor Chang received a Bachelor's of Science degree in physics from National Taiwan University, a Master's of Science degree in materials science from the National Tsinghua University, and a PhD in electronics engineering from the National Jiao Tong University. He is a member of the U.S. National Academy of Engineers, a fellow of the U.S. National Academy of Inventors, an academician of Taiwan Academia Sinica, and a fellow of the Institute of Electrical and Electronics Engineers. He has received many major awards throughout his distinguished career. Some of the recent awards include the IEEE David Sarnoff Award, the J.J. Thomson Medal, and the Distinguished Alumnus Award from the National Taiwan University. He served as the president of the National Jiao Tong University in Taiwan from 2015 to 2019. Professor Chang, the floor is yours. Please go ahead.
Mingzhou, can you guys hear me well? Okay, thank you. Yeah, wonderful. Thank you for inviting me and Professor Jason Wong, who is currently is a faculty on the medicine and the pediatric and the director of the Center for Policy, the Outcomes and the Prevention at the Stanford University. Let me just briefly introduce Dr. Wang, Professor Wang. He's a director, Center for Policy, Outcome, and Prevention. And at the Stanford, prior to coming to Stanford in 2011, he was a faculty member at the Boston University School of Medicine and Public Health. His other professional experiences include working as a management consultant with McKinsey and the company and serving as a project manager for Taiwan's National Health Insurance Reform Task Force. His current interests included first, COVID-19 related policies. Second is developing tools for assessing and improving the value of healthcare, and facilitating the use of mobile technology, improving the quality of care, and supporting competency-based medical education curriculum and engaging in healthcare delivery and payment reforms. He's a perfect, in terms of his understanding of this COVID-related issues, and in terms of the public policy that the government could implement to help ease the pain or the spreading of the COVID. Yeah. Welcome, Professor and Dr. Wang. Yeah, thank you for accepting our invitation to speak at this unique occasion. We do have a couple questions to ask you. So without further ado, do you mind? And I started question one.
Well, thank you very much, Professor Cheng. It's an honor to be invited to this inaugural forum. And actually, I trained at UCLA as a fellow in health services research for 5 years. So,
sorry, I missed that part.
It's good to be back. Yes.
Okay. Thank you. Yeah. Our first question, of course, it has been almost 1.5 years, 470 some days, since the first outbreak of the COVID-19 virus. During this unprecedented time, I actually traveled twice back to Taiwan for a short period during this time. And I knew how much difference that I personally experienced in Taiwan and in US. Almost let me feel is in a different universe, in terms of the status of the infection. I was very, very amazed by how Taiwan can handle that to protect its citizens. Yeah. So in this case, Dr. Wang, you have of course, the research on the role on the big data analytics, the new technology, and proactive testing in Taiwan's successes in preventing the COVID spreading. As the world begins to emerge from the worst of this global pandemic, can you provide some insight into what led to Taiwan's success in the past year? Yeah.
Well, Taiwan's early success in containing the pandemic, I think could be attributed to early preparedness. And so since SARS in 2003, in 2004, Taiwan already set up a National Health Command Center. And that unified 4 different centers, the Central Epidemic Command Center, the Biological Pathogens Disasters Command Center, the Counterterrorism Command Center, and the Central Medical Emergency Operating Center. And so they practice every year on these drills on pandemics. And so I think early preparedness is a key factor. The other thing is early recognition of the crisis. And so in early January, Taiwan has already recognized that this is going to be a serious outbreak and activated the command center, which gave government special powers, including basically coordinating all the resources for the country and the ability to distribute them, and also supported by a Communicable Disease Control Act that's been modified and amended in the last 17 years.
Yeah, thank you. Does the culture, on the other hand, like discipline the people who's willing to take on the face mask wearing seriously and taking, the stress from the mainland China seriously, have anything to do with culture-wise?
I believe so. I think Taiwan's culture, at least part of it, is of self-preservation. And this is a result of hundreds of years of, for example, a history of occupation from the Dutch, the Chinese, the Japanese. And Taiwan was actually under martial law from May 1949 to July 1987. And so during this period, people trying to basically not speak out too much. And as a result, there's a culture of self-preservation. The direct presidential election happened in 1996. And so since that time, people are more open to speaking up and also to do protests. But I think the culture of self-preservation is still there. There's also a culture of filial piety, which is the respect and care of the elders. And so wearing masks and protecting themselves and protecting their grandparents, I think is part of the culture, particularly if people live in multi-generational households and they, and kids tend to be more obedient in schools because of the educational system. And in general, I think in the metro, you could see that people just tend to wear masks to make themselves and others comfortable. And so I think all of this have contributed to the fact that at least initially, Taiwan was able to contain the spread of the virus very quickly.
Yeah. Was there any possibility, in your opinion, for the U.S. or other countries to adopt and implement similar type of strategies, for instance, through careful planning and digital innovation to combat the spread of the virus? Why or why not?
So let me comment on the digital innovation portion of the pandemic response. So very early on, Taiwan was able to send the immigration and customs database in batches to the National Health Insurance database. So integrated these two data sets. And that allows doctors and nurses who are seeing patients in a clinic to identify people who would just travel from abroad in the last 14 days. And so if people have symptoms, particularly if they're coming from high sort of risk areas, they're able to immediately order tests to make sure that they don't have COVID. The other thing they did was sort of digitally with cellular signals, cellular phones. That I don't know if people remember the Diamond Princess cruise ship, and so the Diamond Princess actually docked in Keelung, which is about an hour from Taipei, and about 3,000 people came to the greater Taipei area for a day, and this was before they left for Japan. And so during that period, they visited 50 places, and the government was able to send cellular signals to the people who were around those 50 places during the day that the Diamond Princess passengers disembarked. And that allowed them to get tested for the virus. And so they did use technology. Now, in the UK, you ask about Western societies, whether they're able to do that. In the UK, they have implemented digital contact tracing, so actually digital exposure notification with the Google, Apple exposure notification system. And they have gotten 50% of all the eligible people, 16 and above, to download it. And the data published in Nature have shown that for every 1% uptake in this app, there's a 0.8% decrease in cases. And so it's extremely effective. And so even in Western societies, this could be done. Now, there's a caveat to this, which is that the UK app allows people to decide when they tested positive to whether they want to let the other contacts know. So this is based on Bluetooth technology. And most people did, like 70, 80% of people decided that they want to share that information anonymously. So
Mhm.
without knowing who they are, they share it with the server, and then the server matches.
That's yeah. Mhm. Yeah, my personal experience though, I was tracked, once I arrived at the airport, because I already submitted my cell phone number. So from that moment all the way to the quarantine place, and every day after that, I would receive the 2 phone calls. One is from the central government agency, and the other one is from the local city, the agency, very interesting. One in the morning and one in the afternoon, to greet me and even send me the gift and the thermometer and all kinds of foods. and also send me the TV programs free. I could just watching the free TV. So everything is organized and coordinated so well that I have a free viewing of the TV program for the next, actually the 15 days rather than 2 weeks. Yeah, the quarantine period. Yeah, and I personally I feel that is totally different from what I have experienced here in the Southern California. Yeah, I wish that people could be tracked so well, so precisely, and preventing the further spread from if there is any the possibility of that. Yeah, yeah. Thank you for your comment. My second question is, as the director of the Center for Policy, Outcomes and Prevention at Stanford, you have been involved in policy in terms of improving healthcare system, including developing the Taiwan's national health insurance program. That's wonderful that you have helped Taiwan. What does the sum of the healthcare policies in Taiwan that aided in its response to COVID-19 prevention?
So let me just clarify. I helped to reform the system. I did not help to develop it, and so I was involved in the healthcare reform. So I think part of the innovations in the Taiwan health system is data, and so it's a national health insurance program, and everybody's covered. 99% of the people are covered. And the payment to the insurance is based on your ability to pay. So it's a progressive system where rich people pay more, and if you are poor, then you don't pay. And then so it's based on your payroll tax. And recently they have integrated the electronic records of everybody, so that if you are a doctor seeing a patient in your clinic, you could look up the basic medical records, including sort of the problem list and the medications that the patients is taking from other clinics or other hospitals. So that has been synchronized that way. The other thing that they have done is some of the imaging could not be shared for big data, AI analytics, sort of machine learning analytics, and so that's also very innovative. The part that helped Taiwan this time is the ability to use these data, integrated data, to respond quickly to a crisis. And I think that U.S. Could adopt similar policies. Currently, our data in the U.S. are very fragmented. And to give you an example, I just received a text message from Mass General telling me to get my COVID shot, but I left Boston 10 years ago. And so, in the US, we often don't know who our patients are, because patients could actually change insurance every year. And then each insurance could actually contract with different providers every year. And so the data are very fragmented. And so going forward, there's an opportunity actually to offer, for example, a more integrated data through Medicare. So everyone in the U.S. eventually will be in Medicare. So actually, one idea is to offer Medicare early, because it's a federal program where everybody trusts, and you could actually offer Medicare as a choice, as an option. You could also pick your current insurer, but I think Medicare could be offered as a choice, and then you could build the integrated data from there. But there are lots of ideas being flown around in Congress right now, and I hope that we will make movements in integration of at least health data, so that when there's a public health crisis, that we could respond quicker.
Yeah, thank you for your comment. Actually, after 36 years working in US, I returned to Taiwan about 5 years ago and serving as National Jiao Tong, the university's president. During that period of time, of course, I went to see my local doctors there a few times. I was so amazed. One thing is I had this eye viewing problem in one side of the glaucoma issue. Yeah, and I was amazed at how little the go through the all the examinations and taking medicine and seeing the doctors with all the fancy equipment. I received the event. Finally, I have to pay. I find like 300 Taiwanese yuan. And I look at. I just could not believe that number. Because I should see a 300 US dollars at least, probably if not 3,000. So that was really amazing. So as an expert of the policy and the national insurance system programs, would you make any recommendation to the U.S. if you could to adopt similar policies, and what would be the difficulties and challenges for the U.S. to do so? It's a national program.
Yeah, I think every country is a little bit different. The fact that the Taiwan's national health insurance so far it's been providing all the care, but in a very low price. I think it's both heavily subsidized by industry and by the government, and so personal out-of-pocket payments are relatively low if you are, and everyone is insured, and so there's no issue of cherry picking patients or adverse selection from insurers. And so in a way, that's the positive part. The negative part is that you have one insurer, so there's no competition at the insurance level. And so you ought to compete at the provider level for quality of healthcare. And so, that's one way to compete, because competition is good to bring up standards, to bring up the quality of healthcare.
Okay.
One of the things that I think the U.S. Could perhaps use this opportunity with other countries, other governments, is to set up a health passport system. In that right now, we are in a crisis, but crisis in Mandarin also means danger and opportunity together, right? Yeah. Danger and opportunity. And so we have this opportunity now to at least put some basic data, such as we could start with testing data for COVID, whether somebody's positive or negative. When you travel internationally, you need that. Sometimes when you go to school, you need that. People want to know if you're testing results, and we could do it electronically. And then also your vaccine data, whether you've been vaccinated or not. And then we could build a very basic health passport, and perhaps if people feel comfortable, then we could add on to it. But America is Americans are very serious about privacy issues. That Americans do not want people to the government particularly to collect all their data, and so we have to respect people's privacy, and we have to guard with confidentiality, and we have to respect people's autonomy.
Absolutely.
So all these things that are necessary for the program to move forward.
Okay. As a researcher and administrator myself, I actually aware of the importance of the research collaborations as well as the international academic exchange. What are some of the steps that government and NGOs, including universities like ours, can take to foster improvement in the healthcare globally, especially in response to the threats such as the current COVID-19 pandemic, in your view?
Yeah, I think governments and universities will play different roles. I think governments ought to be in charge of resource gathering resources and distribute them equitably. Whether someone is rich or poor, you ought to be able to give them masks. You ought to be able to offer them vaccination. And so that's the government's role. University's role is to advance the science. And so, so basically, for example, in COVID, we found that, particularly in the UK, their universities work very closely with the governments to sequence the new strains of the COVID virus, the SARS-CoV-2 virus. And so they sequence it very quickly. In the US, that collaboration with our universities is a little bit slower. So when there's a new strain of the SARS-CoV-2 coming into the US, we are slower in responding to this new threat. And so I think, again, governments should work very closely with universities and also with NGOs who, you know, offer services to the underserved minority populations that are often most impacted by a pandemic.
Thank you, thank you. Dr. Wang, another area of your research has focused on the medical education to improve the health outcome. Here in our university, our medical school actually has hosted a translational oncology program, the TOP, with a fellowship for medical students from Taiwan to share our best practices in training the next generation of the healthcare providers globally. We're also collaborating with Zhejiang University and other major universities in the mainland China for training graduate students and healthcare professionals. So in that, can you comment on the needs and also the practicalities of developing a public health or medical training curriculum that can be shared and delivered across borders?
Yes, I think, you know, we're in a very exciting time in medicine. We have the entire human genome sequenced, and we're beginning to really understand the epigenomic impact on gene expression, on the causes of disease. And so, for example, in Taiwan, there's a Taiwan Precision Medicine Initiative to sequence 1 million people in Taiwan. And that's quite a bit because Taiwan only has 23 million people. And so, and there are opportunities to understand sort of the backgrounds, the genetic backgrounds of people in Taiwan, which you know, it's a microcosm, I think, of the Chinese ancestry plus the Polynesian background that's common in all the Polynesian countries from the mother's mitochondrial DNA. And also from other races, there are some also Dutch background, people with Dutch background, and so it's going to be very interesting in having that database to try to understand the differences in cancer, particularly for your program, the translational oncology program. You know, what sort of backgrounds and genes and gene expressions will have a differential impact on the incidence of cancer. We always talk about sort of in terms of translational science, from the bench to the bedside, and then from evidence to practice. And so at this entire spectrum of bench to the bedside and also from evidence to practice, there are lots of opportunities to collaborate across the Pacific in terms of both in terms of talent. You could think of it as a talent circulation, both in terms of resources and materials and strategies to better understand, you know, the different contribution of different racial ethnic backgrounds on disease. And so I believe there are lots of opportunities there.
Yes. Yeah, thank you. Thank you for your answer all the questions. But right away, before officially entering Q&A session, already got the 2 questions from the floor. So let's start to look at those. I guess the first question for Professor Wang would be, please elaborate more on the Taiwan's national health coverage system. Yeah. overseas Taiwanese and the foreigners have in any way to get access to care at a similarly low cost to take advantage of that? Yeah.
Yeah. So overseas Taiwanese people, if you enter Taiwan and you have previously had, let's say if you were born in Taiwan, you will have previous household registration in Taiwan. You could activate that, but it will take 6 months to activate your insurance. However, if you pay for your care entirely in cash out of pocket, it's still very, very inexpensive. It's probably less than 1/10 of what you will pay in the United States. And so, and similarly for foreigners, if you work in Taiwan, you could join the National Health Insurance Program. But if you just travel there for pleasure, then no. Then you're probably going to end up paying out of pocket, which is still very inexpensive.
Yeah, probably 30 to 1. Yeah, you pay the amount, looks like in US dollars it would be tremendous, but you can divide that out 30 by 30 to get the idea of the cost. Yeah. So the second question, a little bit more sensitive. Okay. There has been some rising anti-Asian, anti-Chinese sentiment and violence in the U.S. since the breakout that we are all aware of that. Yeah. So was there any similar scapegoating going on in Taiwan?
I don't think so. I don't think they're scapegoating. I think people are just afraid to be in contact with people with COVID. Just because they don't know how dangerous it is or how to take care of them. But I don't think they are scapegoating. I spent the last 6 months in Taiwan on my sabbatical. And so definitely, I don't think there are any sort of scapegoating going. Yeah.
Okay, thank you. Yeah, that is very consistent with what I have experienced. Yeah, I never actually heard anything like that, but of course, people, all human beings alike, they express their concerns. That is for sure for everyone. Yeah. So another question from the floor is, could you please explain why very recently there has been a more higher the increase in terms of number of the COVID-19 case in Taiwan?
Yes. So recently there's been a surge of domestic outbreak of COVID in Taiwan, and that is attributed to two things. One is that the strain that's currently infecting or spreading very quickly is B.1.1.7, which is the UK strain, and UK strain has been known to spread very quickly. And in this particular case, that the quarantine period for pilots and crew has been relaxed from 14 days to 3 days, and so but the incubation period for the virus and the latency period, the latency period is the period where between when you get exposed to the virus until when you become infectious, it's 3 to 5 days. And so when you release people at 3 days, that's when they're going to be start to spread. And the incubation period is when you have symptoms. But in this case, a lot of people with COVID has no symptoms. And so 40% of the people infected with COVID has no symptoms. So you don't know if they have COVID, so they start spreading. And so in this case, it's quite unfortunate because pilots they are constantly under quarantine, so are the crew, and so they relax it to improve their mental health, basically. Otherwise, they will constantly be either doing their work or being in quarantine. But in this case, I think that they should have thought more carefully before they relax that to 3 days.
Yeah, there's another question is on the more the general directions, just the techniques that we learn or policy that we learned from this COVID prevention. Would that also be useful and instrumental into the future to prevent of other things, other diseases, like SARS or other, well, of course, this is SARS number 2. I mean, the previous SARS or other infectious diseases in general. What would be the comment for the things that we learned for human to learn here to prevent the more serious the disease into the future? Yeah.
Well, I think a lot of things has been learned in the last year and a half, and so for one, we learned to collaborate across.
That's important. That's right. Yeah.
Across industries, basically, in terms of in many sectors. So in education, we learn to do education online. In healthcare, we learn to do telehealth. We learn to produce an effective vaccine very quickly within months, and that's unprecedented because previously the shortest period for producing a vaccine was 4 years, 4 months, and usually it takes 10 years to produce a vaccine. In this case, it took months, and that's because of international.
Incredible.
And that's because of international collaboration with both at the bench and also during clinical trials across the globe in multiple countries where there are disease outbreaks. And so we learned to do that. We learned to produce respirators very quickly and invent new ways of creating respirators. And so there are a lot of positives that have come out of this crisis. And certainly we learned that, when you don't know what's going to happen, you need to be a little bit more cautious. So not every infection is just a flu. So you need to be very cautious, and it's better to be more conservative than in the beginning.
Thank you. Because of the time constraint that we just have to close the session soon. But before we do that, I would like to pass my baton to Director Ming Zhou, and you probably like to say something to the audience and to every one of us. Yeah, thank you again, Jason, for your outstanding talk, and we really learned and enjoyed the interaction with you a lot. Thank you very much. Looking forward to seeing you more on campus. Yeah.
Thank you very much.
Thank you very much, Professor Wang, and thank you very much, Professor Chang, for this insightful, interesting, and informative discussion. Again, I'm deeply grateful for the generous gift from the Taiwan Ministry of Foreign Affairs and the tremendous support we received from TICO in Los Angeles. We thank Director General Wang and his staff at TICO LA, particularly David Lin, David Chen, and Rebecca Lan. I also thank Vice Provost Cindy Fan for her leadership and support for our center, and thank our center's staff, Executive Director Elizabeth Lester, Assistant Director Aaron Miller, and Student Assistant Lauren Lip. Thank you all for coming, and please watch out our center's news and event announcement, and I hope to see you again in our future event. Thank you, good evening, and good morning. Thank you so much. Bye-bye.
Thank you all. Yeah. Thank you, Dr. Wang.
Thank you.